Perfect. Looks like we are on and live. You live over there, Dr. Pitts?
I'm live. I'm working.
Perfect. All right, guys. So we've been talking about this for a while. I appreciate all of you that are on here. This is Dr. John Pitts. He is an MD out in Denver, Colorado, and he specializes in something called orthobiologics. And I want him to explain exactly what he does. You know, a lot of you guys have heard buzzwords like stem cells, PRP, maybe even prolotherapy. But what is that? You know, how can you guys benefit from it? You know, what are some of the myths? What are some of the truths? We'll get down to all of that. Dr. Pitts, you know, go ahead and introduce yourself and what you do specifically.
Yeah, appreciate it. Thanks for having me here. So, yeah, I'm Dr. John Pitts. I'm a medically trained doctor, specialty in physical medicine and rehabilitation, which is the most common field that you're going to find providers who are knowledgeable and skilled in what we call interventional orthopedics and regenerative medicine, which is basically a field of medicine focused on treating musculoskeletal problems. And instead of the traditional pain management approach, we want to use the approach where we do some type of injections that help stimulate the body to heal itself. And so orthobiologics are basically substances that help your body to heal itself. And so after doing my PM&R training, which is a field that is solely focused on musculoskeletal medicine, non-surgical intervention, I did another year of training where I work now at the Centeno Schultz Clinic, which, you know, Centeno and Schultz are two of the founders of a lot of this field. So trained out there with them in this area. Some other physicians who may dip into this area would be sports medicine doctors that have family medicine doctors that have additional training in sports medicine, anesthesia doctors that have additional training in pain management or spine procedures, a rare interventional radiologist, and rare orthopedic surgeons. But most times surgeons are focused more on surgery rather than non-surgical treatments. And so that's just kind of my background and what that is. And so basically we will inject things like prolotherapy, PRP, bone marrow concentrate containing stem cells, culture stem cells, etc., with the goals of healing damaged tissues in the musculoskeletal system versus the traditional approach of injecting steroids, which may help pain and inflammation, but they come with a lot of potential side effects and risk, or nerve ablations, which can help pain for sure, but you know, you're damaging structures and nerves to achieve that goal.
Absolutely, yeah. So tell me a little bit about, you mentioned the stem cells. What kind of stem cells are you using? Which ones do you hear about that have been shown not to work as well? Like, we've heard all of it. You know, you've heard like that jelly stuff. You've heard about like the umbilical stem cells. I mean, there's all different types. You know, what are the good ones? What do you guys do? And I know you guys have a clinic outside of the country, because, correct me if I'm wrong, the FDA kind of limits some of the stuff that you guys do.
Yeah, I'll get into all that. So, yeah, it's a very confusing topic. So when you say the word stem cells, it has many different meanings. So the two main types of stem cell procedures that are legitimate stem cells, that mean you have live functioning stem cells and are allowed per FDA regulations. Number one is going to be bone marrow concentrate. Okay, so that's basically taking out bone marrow, typically from the iliac crest or kind of back butt bone, concentrating the cells in there, which is a bunch of cells in there that can help you heal. And we think the most important of those cells are stem cells. And so that's allowed per regulations. Those live functioning stem cells. That's the most researched and studied product here in the U.S. The second, real stem cell procedure in the U.S. that can be done is an adipose graft. So this is basically just taking fat tissue from the butt area or the stomach area, and you can break the fat up a little bit mechanically, and there's stem cells in fat tissue, and those tissues can be used to treat a couple of musculoskeletal problems as well. Has some evidence, not as much as bone marrow, but those are live functioning stem cells that can be helpful for the musculoskeletal system. All right, now if you take either one of those two products and you process a little bit further, so with bone marrow, you can then isolate stem cells in a lab, grow them out to much higher numbers. That's called cell culturing. Then you get a pure stem cell procedure with cultured cells, but that's not allowed per FDA regulations in the US. So we go down to Grand Cayman where there's allowed, and we can perform those stem cell procedures there. And these are stem cells coming from you. So we call that autologous. So coming from the same patient, going back into the same patient that has the most evidence and the most safety. You can do the same thing with fat cells as well, and they probably work similar, but bone marrow has a little bit more research, a little bit more safety profile, but both of those are viable options to culture out and grow. We tend to lean more towards bone marrow cells for that, but those are not allowed in the US, okay? And then in the US, you might hear of placental or birth tissue products, such as umbilical cord cells, amniotic fluid, amniotic membrane, chorion, Wharton's jelly. All of these are different parts of the sac that surrounds the newborn baby. And so when a baby is born, that placenta is discarded basically. But instead of discarding that, you can collect some of those products and then process that and use that for different things. And so in the US, though, there's no approved products of the use of birth tissue products in orthopedics whatsoever, because that's basically like creating a drug which needs drug approval trials. And so that's not approved. And all these tissues, how they're processed, you basically use something like irradiation to kill all the cells in them. So already you have dead tissue cells. And what you're left with is maybe some growth factors and structural proteins that may or may not be helpful or have some helpful growth factors, different but similar on the level of PRP. But again, we don't have really any research papers to show that helps in orthopedics. And again, that's not allowed in the US. So any clinic in the US claiming to have umbilical products, placental tissue products, and saying there's live stem cells and they're young and healthy and you're old and you need these young stem cells, either that's a scam, so they know that it's illegitimate and they're still offering it, or they just don't know any better. And both are equally as bad. So those you want to stay away from. And then some people think of embryonic stem cells. There's no embryonic stem cell use in the entire world. These are just for research. Those are the cells that come from undeveloped embryos that have more ethical controversy. So those aren't really a thing. And then if you really want to get into it, you can actually take cells like from your skin or any other normal cell and use things in the lab to convert those into stem cells. Those are called induced pluripotent stem cells. And again, these cells are not used in any clinical research in humans because these cells are more dangerous because they can turn into every tissue type. So these are those cells that are more likely to cause cancers and tumors. So far, when I've talked about bone marrow concentrate, fat grafts, cultured autologous bone marrow and fat stem cells, none of those has any evidence to show that it's causing any cancers because those cells don't turn into every cell in your body. They can just turn into some cells in your body like cartilage, bone, things like that, tendons, ligaments, etc.
Gotcha. Well, that definitely clears up quite a bit because you hear it just as much as I hear here in St. Louis. So many people claim to be doing, stem cell injections, PRP. Unfortunately, as much as I love my profession, a lot of chiropractors, will claim to have these proprietary stem cell blends. But just like you said, Dr. Pitts, I'm assuming BMA or bone marrow is the most common that you guys do.
Yeah, BMC, we call it. You can do bone marrow aspirate. That's basically just taking bone marrow, but you do no processing. Okay. There's some places that do that, but the evidence is most consistent and detailed with bone marrow concentrate. So that's taking bone marrow, getting rid of the red cells and concentrating out the cellular portion of that.
Gotcha. And so one thing I failed to mention, you guys, Dr. Pitts is my doctor. Okay. He's been taking care of me for 3.5 years now, going on 4 years. God, if we would have been talking on that first visit and said we'd be doing this right now, that'd be crazy. I don't know anything about this. Why would I do a webinar with you? But so we'll get into that and what he treated me with, you guys. I've had, just a severe debilitating injury that I've dealt with for 4 years, and Dr. Pitts and a few other providers completely changed my life. The injury that I had specifically, it's called craniocervical instability. Again, we'll get into that in just a second. Before we do, because that is something that Dr. Pitts really specializes in, which is, again, CCI, craniocervical instability. Dr. Pitts, tell me, what are some of the major conditions that you see coming into your office? What are people complaining of, and what do you guys have good success rates with Orthobiologics? Yeah,
absolutely. So we treat the whole musculoskeletal system from head to toe. So anybody that has ligament sprains, tendon injuries, tendinopathy, tendonitis, some people call it, arthritis, spinal problems, etc. We kind of see and treat. The two most common things we treat are like spine, low back pain. So those are degenerative disc, radiculitis, pain going down the nerve, the sciatica, low back pain from facet joints, etc. Knees are very common. So knee arthritis, meniscal tears, ACL injuries, things like that, shoulder, rotator cuff tears, little finger and thumb joints, toe joints, all those things, neck, of course. So any parts of the musculoskeletal system we treat. And basically, we fit in very nicely when conservative measures like rest, activity modification, physical therapy, chiropractic, etc., doesn't kind of resolve the issue all the way, but you don't necessarily need a full-on surgery, okay? And too many times when people fail conservative care, they just skip right into surgery, whereas they either don't need that surgery or we have better options that can help them avoid that surgery. And then, of course, there's some problems that, just need surgery no matter what. So we're not going to treat you. You got some major fracture. You've got a complete ligament, a tendon that's ripped apart. You've got a spinal cord injury or severe nerve damage that's just getting squished. Those things, absolutely, you need surgery for. But most of the time, when you think, I have this pain, I have this injury, a lot of times you don't need surgery for that. And so that's where we fit in very nicely. Always better, smaller problems rather than bigger problems. So if we got mild to moderate arthritis, we just got tendinopathy or small partial tears in tendons and ligaments, those are going to do great, okay? Especially if we catch those things early. We don't always catch things early. Most of the time we don't, because patients are coming to the doctors often as a last resort. And so we still can help out more severe problems, but it may take more work or it might not be as great, or, some might succeed, some might not. So it's always better to get smaller problems before they become larger problems in general.
Yeah. And Dr. Pitts makes a great point. There is a time and place for surgery. I've had plenty of patients where I'm like, it might be a possibility, I refer out. I know you do all the time. But like you said, if we can catch it ahead of time, the regenerative medicine route's going to obviously be way better, because you are going to be able to actually heal that tissue that you already have and bring it back to where you were.
Yeah, I just like to say this. A lot of patients are scared, especially with muscular problems, to go to the doctor. They think, one, maybe I can just tough it out or get better on its own. Yeah. Or two, they just think, oh, I'm going to go to the doctor. He's going to recommend surgery. I'm going to have a lot of downtime. I don't want that. So your first step when you have a musculoskeletal problem, it's not getting better within a few weeks or so, you go see a non-surgical doctor. So all those doctors I named at the beginning, PM&R doctors, sports medicine doctors, pain management doctors, they're all going to be trained in non-surgical interventions that can help you. Even if it's not regenerative medicine, they will at least let you know, hey, this is a problem that you can maybe help, versus, oh, no, you definitely need surgery. Versus if you go to most surgeons, they're either going to say you need surgery or you don't, and they're not going to give you many options in between, and not going to be as versed in most of the in-between options. So you want to go see a non-surgeon so you can get evaluation, get direction for your physical therapist or chiropractor, and then, see what kind of non-surgical options you have. Okay.
Awesome. Love it. So what I want to do here is kind of pivot into one thing that I really wanted to focus on today, craniocervical instability. So, sure, I'm biased because I had it, past tense had it because Dr. Pitts helped me with it. So what is it, you guys? I'm going to give, a description of what I know it as, and then Dr. Pitts, I want him to chime in on what he sees it as well. So just to kind of put it in a nutshell, though, some of the common symptoms that can be caused by craniocervical instability, can be anything from headaches and migraines to brain fog, tachycardia, which is fast heart rate, fast respiration, digestive issues, neck pain, shoulder pain, visual disturbances, balance issues, dizziness. I got a patient right now with it who she can't even go underneath bridges because the fluttering of lights aggravates it. So how in the world can one single injury affect so many different symptoms? Well, what happens, you guys, and if you guys read my blog, which I'll post to here, is we have a bone up here in the upper neck. It's called the atlas. I've got a little model here. Here's the back of your skull. Underneath your skull, so again, your face is facing me, is that cervical vertebra. All right. The problem, though, is that vertebra is prone to shifting around too much, all right, aka instability. So when that occurs, it can cause a cascade of many different causes. It can create tension or compression on the brainstem. It can create tension on the spinal cord. It can create even hypoxia, not anoxia, but hypoxia, less oxygen to some of those soft tissues. And so we can adjust away all we want, but it's never going to stay in place unless you do it, one, precisely, and then two, we take care of those ligaments. And that's where Dr. Pitts comes in, all right? You guys have all heard of chiropractors taking care of misalignments or subluxations. Yes, that's true. And then you guys get better and it sticks because we do a good job at adjusting you. There's some patients where it doesn't stay. Why? Because those ligaments become disrupted. What are ligaments? They hold bone together, all right? So when I move around, when I go work out at the gym, when I play soccer, what am I talking? I never play soccer. When I play pickleball, when I'm running around, all right, everything should be in place. But when it's unstable because there's no ligaments, everything slides around. It'll irritate tissue. It'll irritate some of the nervous system. And then the nervous system becomes dysregulated, and you have all these crazy symptoms that you're chasing, like neck pain. Oh, let's look at the lower neck. Let's look at the lower shoulder. Let's look at the mid-back, because we're chasing this pain. And it's not until later when you find someone like Dr. Pitts or myself that start taking this history and then correlating it with some imaging, correlating with orthopedic testing. Dr. Pitts was one of the first to tell me, he's like, you know, Brett, honestly, he goes, the MRI tells me, you know, a lot, but only the MRI tells me like maybe 10% of what I want to see. Dr. Pitts made it very clear that like we got to put everything together, diagnose you properly, and then go from there. So what I want to talk about is how you would treat something like CCI. But before I do, Dr. Pitts, you know, kind of fine tune what you think or know CCI is, so everyone gets an even clearer understanding of what it is.
Yeah, you did a great job of explaining it. You know, basically, you know, cranial, you know, the top of the skull, cervical, where those two meet, instability. So that means there's a damage to the ligaments that hold the skull and the top two bones together. So there are specific ligaments that can get damaged that cause that. Popular ones are the alar ligament, the transverse ligament, apical ligament, tectoral membrane, etc. Plenty more. But, you know, it usually happens after a traumatic injury. So if you get into a major car wreck, hit to the head, fall, something like that, it can cause injury, major whiplash injury. Some patients can get it without a major injury. These are typically patients that have hypermobility genetically, like patients with EDS, so they can have that. And sometimes patients might have some minor traumas that build up over time. So it wasn't just one big trauma, but little traumas that built up and those ligaments never healed up, and that leads to instability over time. And so the problem with ligaments is that they can partially heal on their own, but they don't get good blood supply and they don't have a vast supply of local healing cells. So once they deplete the blood supply they get in the local cells, they tend to just partially heal and they remain injured. And if they remain injured for a long period of time, it's going to cause stress on different areas. And that's basically what leads to arthritis, etc. Now, the problem with the craniocervical junction is that's where the base of your brain and your spinal cord is. So any irritation in that area is going to cause irritation to possibly the base of the brain, the spinal cord. Also, your cranial nerves come out through that level. So that's why if you get irritation to like the vagus nerve, that can affect your heart rate, your digestion, your mood, anxiety, etc. You can get injury to other nerves that affect swallowing. You can get injury to the joints that affect your position sense. So you cause lightheadedness, dizziness. It can affect the blood flow coming in and out of your brain, or the cerebral spinal fluid coming in and out of your brain. So that can cause headaches and pulsatile sensations. And then on top of that, your muscles want to protect you, so they get extra tight. And so the muscles hurt themselves, and you relax the muscles and maybe feels a little better, but then they have to get tight again because they're protecting the neck. So a whole cascade of problems. And so I see patients, they've been to the cardiologist because they got the racing heart rate. They've been to the neurologist for the neurology problems. They've been to a traditional pain management doctor who isn't familiar with craniocervical instability because you don't really learn this in school, and they can't get a diagnosis, and they've been told, oh, nothing's wrong with you, you're crazy. And so it can be really, really frustrating. So it's really nice to have some resources The good thing is that, hey, many chiropractors are more versed in this area compared to physicians. So if you find a good upper cervical chiropractor, they might be able to help make the diagnosis. And traditional MRIs don't show ligaments well. Instability is dynamic, so that's movement, so it doesn't show that well. So you have to really be looking for craniocervical instability to find it. So I'll just leave it there for now.
So in one way that, we really look to properly diagnose it, like I said, MRI helps a little bit, but Dr. Pitts made a good point. It's more of a dynamic, injury. So we have to watch and look in like a live footage, AKA a digital motion x-ray. I'll watch a patient flex their head back and forth, and I'll look for those vertebrae sliding too much, and that'll help us quite a bit. I have a few static x-rays that I take in my office too that give me quite a bit of information, where we'll kind of force the head to the side, and then I'll watch the vertebral just slide to the side.
Yeah, and as far as diagnosis, just imaging wise, the most likely test is going to show instability. If it's there, it's going to be the digital motion x-ray, like you mentioned. Maybe second most, which is probably more of a distant second, is an upright MRI with flexion extension, but it has to have special protocols. And then least likely is a regular MRI. Rotational CTs, a lot of radiation. I don't really order those, but sometimes I can show it. And then Dr. Rose up in New York has a great imaging where he can actually track the CSF flow, and that can show some issues, and it's extremely detailed as well. But DMX is kind of, wouldn't say, I don't use the term gold standard, but that's the best test if we're going to look for CCI. That's always where I tend to start.
Absolutely. So what I want to do is, I don't want to sit here and talk about myself. However, what I do want to do is I want everyone that's going to be listening to this to understand that I can 100% relate to you. Dr. Pitts can, because he sees the conditions, but I had it myself. And I just want to kind of give you a brief idea of what I went through for some of the most miserable 6 years of my life. It was, how do I begin this? It all started initially when I was working out quite a bit, heard a pop in my neck. Next thing I know, 6 months go by, just extreme tightness along the neck. I did everything. I saw every chiropractor. I saw every physical therapist. I did energy work. I did Reiki, dry needling, physical therapy, prolotherapy, which does still work, but not for this severe of a case, I feel. I saw, let's see here, neurologists. I went the medical route. I took medications. I took painkillers, muscle relaxers. I did so much, zero relief, absolutely nothing. And so it wasn't until I met Dr. Pitts when things started to change. And a lot of my symptoms were not just pain. That's where you guys got to remember, this condition causes way more than pain. In my opinion, sometimes pain was the least of my worries. It causes extreme anxiety, unexplained depression. I never suffered from depression. Like, I was always super active, had a good purpose, had a good discipline. And out of nowhere, I'm like riddled with anxiety. And then I started getting headaches. I didn't get headaches as much as most of you guys do, though. A lot of people get migraines. I would get the craziest brain fog that when I would get done adjusting patients, I would go home, and I'm not saying this for sympathy, but I would literally go home, I would lay in my bed and cry like a grown man, because literally it was that miserable. I would go home, and all you think about is, shit, I don't know if I can curse on here, but I would literally say, shit, I don't know if I can legitimately live like this the rest of my life. And I know that sounds dramatic, but it's true. And so I totally 100% get what these patients are going through. You think, like, how am I going to, get married and be a good husband? How am I going to get married and have, be a good father, be a good friend? My social life was completely sacrificed. I never went out. My patient or my friends, they always just assumed, oh, I mean, we can ask his twin brother to hang out, but we know Brett won't because he never goes out anymore. And that's because I would be in pain or I'd have brain fog. And you can't think straight. Imagine windshield wiper fluid, your cerebral spinal fluid going through your brain, but it's not flowing well. And so your brain is just so wrapped up and you can't think straight. So I went through that for quite a while. And then finally I saw Dr. Pitts, and we did, about 2 or 3 procedures. Keep in mind, guys, my procedures I do way more often because I beat myself up adjusting patients. However, we did a few things, and then, boom, I get rear-ended. Get in a car accident, and symptoms get worse. Thank God I had Dr. Pitts. So Dr. Pitts, why don't you tell them about what you guys do for craniocervical instability? They are the pioneers and the only ones in the entire world that do something called the PICL procedure, the PICL procedure. It's like the most impressive thing I've ever seen. And Dr. Pitts has been doing it for me multiple times.
Yeah, absolutely. So, yeah, once we get the diagnosis, and man, that was a touching story, and I hear it often. And I got some patients who are like, man, they're literally bedbound 23 hours a day, and they can't function whatsoever. And so, we're not going to get those patients miraculously running marathons, but heck, you get them up and able to function throughout their life and can work and can see people, and only have to be in the bed laying down maybe 15-minute intervals in a day. Boy, you've changed somebody's life, because like you said, it can be really depressing and you can go to dark places. So, so I got to give all the credit to Dr. Centeno and Dr. Schultz. These are the guys that, that taught me all this. These are the guys that invented the PICL procedure. So those are the gurus, and I just happen to be lucky to learn from the best. And so with the PICL, huh?
I said you're too humble.
No, this is all true for sure. And so, before, when we would recognize craniocervical instability, but all we could do before, we can treat the upper neck joints with like PRP or bone marrow concentrate inside those joints that are getting damaged and arthritic. We can treat posterior ligaments, so supraspinous, interspinous ligaments, POM, etc., that are easy to get to and safe. But the main ligaments that are damaged in craniocervical instability, you can't reach easily through the back because the spinal cord's in the way. And so we had to figure out a way, how the heck do we get these ligaments in the front? The transverse ligament, the alar ligaments. And so Dr. Centeno and Schultz came up with a procedure, the PICL, to go through the back of the throat. How crazy is that, to reach these ligaments? We started doing that in 2014-ish, slowly, and then have just learned more and more and perfected that procedure and made advances to really be able to accurately target those ligaments. And it has been a game changer for patients. And so what we have the ability to do now is get those ligaments stronger. So now you have the stability. And then we typically always couple that with some upper cervical chiropractic care, because that works for most patients as well, to help with the alignment, help reset the nervous system. And that combination has worked extremely well. Now, if we catch a patient within that first year of an accident or injury, oh my God, you can probably just do one of those procedures, knock it out the park, and you'll be brand new, like nothing happened or close to it, 80, 90, 100% recovery. The problem is, since these problems are hard to diagnose and not everybody knows about us or gets in to see us right away, we see patients that have been 3, 4, 5, 10, 20 years even, who've never had a diagnosis and just been dealing with this. So for those patients, we can still help them, but it typically requires maybe 2 to 4 procedures to get them there. They're not going to get 80, 90, 100% better. They're going to maybe get 50, 60, 70% better, which is still life-changing for them. But it just stresses the importance, again, trying to address these problems sooner. This is why we do these kind of podcasts, so we get the message out so you know who to look for to see if you suspect this diagnosis, who can help out. And so for that procedure, the PICL, we only use bone marrow concentrate, because it's such an invasive procedure that we want to put our best foot forward. And bone marrow has the best evidence and clearest theoretical ability to heal ligaments as much as possible. So that's that procedure. And at the same time, we can treat any associated problems with that. So, we can treat those upper neck ligaments. We can treat the posterior joints if needed, the posterior ligaments. Some patients have shoulder injuries or lower neck injuries, disc problems, etc. So we're able to treat all of those things. And so some patients even, present with mostly lower neck problems, and it fixed the exam, it fixed the history, it fixed the MRI, and they get better, but they don't stay better where they usually should. And then that's what, what happened with Brett. We had to look, he didn't really have all the typical symptoms initially. And then we dug a little deeper and oh yeah, he's got these other things. Now that we see that the lower neck's getting better, now we see these upper neck problems. And then we're able to diagnose and address those. So it's total game changer. I'm just fortunate to have been in a place where I can learn from the top doctors and get really good at it myself as well.
Yeah, I mean, like you said, Dr. Pitts, it really is a game changer, because prior to 2014, when you guys were doing this, these patients, they'd either just be miserable, they'd be called crazy, put on antidepressants, And then, or they'd also be fused. And that is one of the worst things you want to do is fuse. That should only be happening, you know, where, you know, horrible trauma happens and we got to fuse it.
Yeah, and this is a good point to bring up, is that most of the time when doctors think of craniocervical instability, they think of Hangman's fracture or your head is literally falling off. Like, those patients don't come see us. You're in the emergency room, you're diagnosed right away, you're getting surgery, you need surgery. It doesn't matter how severe that surgery is, you need it. But most of the patients we see, you know, these are not severe fractures, these are just partial ligament tears. Yep. And so these folks kind of don't fit that typical mold of head falling off, automatically need surgery, but they're not getting better on their own. So this is a great in between. And then, of course, some patients, even their problem is more severe, maybe been going on too long, or they failed all other options. Then, you know, some of those patients will need surgery. This procedure is not 100% successful. Nothing in medicine is, but it works about 70% of the time. So 7 out of 10 times we're able to get people back to functioning, so they don't need to undergo fusion surgery or just be left miserable.
Absolutely. And I want to piggyback off of what you said a few minutes ago about how, you know, you guys do the procedure, but you also recommend some, you know, complementary stuff. You know, you recommend patients seeing, you know, whether it be an upper cervical chiropractor, a physical therapist, massage therapy. But what I want to talk about is how important it really is for CCI patients to really have a multifaceted approach to their care. And that's one thing that I've found with both my patients and myself healing, is that when it comes to CCI, you know, Dr. Pitts and the staff there, they're going to do an incredible job with the ligament integrity. But one thing to add to speed up that recovery is 2 things. Number one, of course, I'm biased because I'm an upper cervical chiropractor. We'll talk about that here in a minute and what that means. It's not traditional chiropractic. And then physical therapy. All right. Physical therapy, pretty straightforward. All right. We have to stabilize, you know, the scapulas and the shoulders. Why? Because all those muscles around here come up and attach to the upper neck. Okay. Levator scapula muscle is a very commonly tight muscle, and we have to work on that. And there's many methods to that. I'm fortunate that I had a physical therapist work with me, and he's gotten me so much better. And now I've actually taken some of his stuff and implemented it into my office now. Now, upper cervical chiropractic, what is that? How can it help with CCI? Let's talk about that. So first and foremost, if you had CCI, and I knew it with absolute confidence, or scratch that, if I even for a second even have a hunch that you have it, I am not going to manually adjust you. Why? Because what does a manual adjustment do? A ton of things, but that's a conversation for another time. But it also improves mobility. You have too much mobility already. If you have CCI, things are jarring around. Again, remember that atlas vertebra right here is just, it's moving. Here we go. It's shifting around too much. If I come in here and move it even more, it's going to irritate things. Now, you'll get good relief for temporarily, maybe like an hour or so, and you keep coming back, and it keeps coming back, and it never gets better. So this is what we do. I'm an upper cervical chiropractor, and I practice specifically something called orthospinology. We use an extremely precise, objective approach to find out what your misalignment is. So when you come in, yes, I'm going to take a history first. I'm going to see what's going on, which will dictate what kind of x-rays you need. And then what we're going to do is we're going to take a series of x-rays, and they're going to tell me up to a 1/16 of an inch of precision just how everything is shifted and rotated. You got to remember, x-rays are a 2-dimensional image. And so what we do is we take multiple different images to give us more of a 3-dimensional reality of how everything is misaligned. Then what we do is we make a bunch of measurements on the joint surfaces that eventually create us in a big equation that provide us with what we call a vector. So what is a vector? It's just a fancy word for the way and the angle that we adjust you. So in other words, it's like your fingerprint. So it looks like I'm adjusting everyone the same way, but it couldn't be any more different. Everyone has their customized adjustment, or rather their customized vector. So you come in, you get x-rayed, I get your vector. It's a bunch of cool, crazy looking numbers and stuff. And then, this is the best part, is we'll adjust you, and then I'll post x-ray you, and I'll show you immediate changes. So we'll literally see rotation of that vertebra reduce. So it'll go from here to here, or it'll go from here to here. And that will then give us that objective data on just how much we're helping you. That way, let's say hypothetically speaking, we're adjusting you, and then you plateau. What's going on? We're going to retake some x-rays, and we're going to make sure we're consistently keeping that bone aligned. The problem with CCI is that those ligaments are still loose, so it's difficult for CCI patients to hold that adjustment. So what I do in my office is, one, we adjust the spine with an instrument very lightly. So when we use these vectors, I'm not using my hands and putting pressure into it. Again, I can't stress enough. It's way too much, okay? At least for CCI. Most other patients, by all means, any chiropractic adjustment, any upper cervical technique's great, just not CCI. So we'll adjust very lightly with an instrument. I mean, you can't break the skin on a grape with it. I mean, it's so light. And then for CCI, I will follow it up with some physical therapy. I never did physical therapy in my office at all up until, quite frankly, last year. Why? Because it works well with CCI patients. I can adjust you as much as I want, but it's never going to stick unless we take a multifaceted approach. What I tell my patients on day one, is I want to see you as little as possible, but still get you the best results as possible. That way, you're not relying on me for the rest of your life thinking, oh, I can't live life unless I'm seeing Dr. Lux, 3 times a week for the rest of my life. That's insanity, Dr. Pitts, what else do you guys recommend in conjunction to specifically upper cervical chiropractic?
Yeah, absolutely. So that was a great explanation. And so how we think about adjunctive care, because there are going to be 3 big things that we're going to recommend at some point to most all CCI patients. Number 1 thing is going to be upper cervical chiropractic. So orthospinology, atlas orthogonal, NUCA, they all kind of branch from similar origin.
Yes.
But those are kind of the main techniques that we will send. And we'll have you, hey, do that before even coming to see us. Right. Because sometimes if you have a mild CCI, those methods alone can be helpful. Save yourself some injections. If those if those things are helped temporarily, but then they keep coming back, that's when okay, so it works for you, but it's not holding. You need us to intervene, help the ligaments. And then after we treat you, what we tend to find is that then you go back to your upper cervical chiropractor, the adjustments are holding longer. So now instead of 2 days, it holds for a week. Then it starts to hold for 2 weeks. Then it holds for a month. Then it basically holds unless you did something to knock it out of place and you just need some periodic adjustments here and there. The second thing is that what we recommend is definitely physical therapy. But a lot of CCI patients can't tolerate physical therapy. Yeah. If they've had their problem for a long time, anything you do bothers them. It flares them up. They can't handle it. So after we treat them, then after they start to get better and the ligaments a little more stable, they're less fragile, then we'll start some gentle physical therapy. We have some online exercises to start with, but then you just want to make sure you got a good physical therapist that's gentle. And we really want to strengthen the upper back, the shoulder girdle, deep neck flexor muscles, etc. Starting off just where you're at. So some patients with CCI, if they're healthy and strong or mild injury, can tolerate PT first. Others need to wait till after treatment. And then the third thing is some curve correction. Like a CBP chiropractor or other chiropractors specialize in the curve, or some therapists that specialize in that. And again, lots of CCI patients can't tolerate that at first. But again, after we treat them, if we can help restore some normal alignment and curvature to the neck, that takes pressure off the upper neck as well. And so those are kind of big things that we recommend. But, not everybody's going to be able to do that. But I just like to emphasize that, with upper cervical chiropractic, it's no safety concerns, right? So, it's very, very gentle. We have no issues with trying that out. And again, most patients respond to it, at least temporarily, but nothing works 100% for everybody. So, but that's always something we recommend. And we never want any, high amplitude adjustments. We don't want any manipulation of the neck. So you definitely want to avoid those things. And then one other thing, some patients tell me that they help, that's very gentle, is some craniosacral work. I don't understand how that works fully, but I've had patients, say that helps them symptom-wise as well.
Yeah, absolutely. And there's multiple branches of upper cervical that if you guys want to look at, just Google, and a lot of times they have a directory. So the ones you guys want to look up in your hometown are going to be, orthospinology, AO, NUCA, that's very light as well. let's see what else.
What's your thought on Blair, maybe?
Yeah, Blair's good. You got to be careful. Again, Blair is an incredible technique. I've had it done on me, but some Blair chiropractors can be a little aggressive. So that's where I'm kind of hesitant sometimes.
Yeah, I've heard some mixed reviews on that as well.
Yeah, and again, you guys, upper cervical is great for the vast majority of people. CCI is not like this crazy common thing. So most people go see an upper cervical chiropractor, you'll do great. But CCI, stick to those few that we mentioned. And then one thing that you guys will find is that the upper neck, I almost failed to mention this, will affect even stuff down into the low back and into the legs. I mean, I got a patient who comes in, you know, about once a month to get an adjustment, and I'm just talking to her one day, and she goes, the only reason I come in here is because you make my knees feel better. And I was like, really? She's like, I'm like, Amy, you never told me that. Light little tap, again, wouldn't break the skin of a grape, and it affects her knees. It's incredible. And for those of you that are in the profession, how in the world does that make a difference? And how does that work? It's really actually kind of simple. Unfortunately, we don't learn it in the schools. Even neurologists don't learn it. So like when I bring it up, neurologists think I'm crazy, but obviously.
I mean, it's basic anatomy. The top of the spinal cord is getting affected.
Yeah.
The way your legs move is through your brain, talking through your spinal cord, talking through those nerves. Exactly. So anywhere along that pathway can affect anywhere below where the injury is. So if you're at the top of the neck, everything below the top of the neck could be affected. I've had one patient completely no neck symptoms when we initially talked to him, all leg symptoms, all radiculitis in the lumbar spine. Treating him, he's getting better, but it's just weird. And I'm like, let me just look at your neck and just see, because we looked at the neck and we didn't see anything on a regular MRI. Finally got the DMX and found out he did have CCI, and we're able to start to help him more after treating that. So it can be really weird sometimes. Those aren't typical, but you know, it could be solely just leg symptoms, which is really crazy. Yep.
Yeah, I had a patient come in, you know, a few months back, and she had been seeing a neurologist for like 15 years, and she'd had these debilitating migraines where she'd go blind, like temporarily, where she just couldn't see. And what was it, like 3 weeks into adjusting her, 0 headaches, absolutely nothing. You know, some of this, I mean, when we affect this, like Dr. Pitts does and like I do, it'll completely change someone's life. You know, I've got someone who is wearing hearing aids to block out outside noise because his ringing in the ears is so bad. Started adjusting him, and after about 2 weeks, he came in and he's like, Dr. Lux, you know, I couldn't believe it. I got home from work, I walked into my apartment, and I was like really confused. I was like, what do you mean? And he goes, I was confused because it was the first time I had been in my apartment in like 2 years where it was like dead silence. Like he's used to walking in and just like ringing. He can't think straight. You know, it's stories like that that, you know, make me realize just how powerful what you guys do, what we do, and how everything coming together makes such a difference. If there's one thing I've learned for all you patients, it's that a lot of health is going to come from a multifaceted approach. We have to put down our ego, put down our dogmatic philosophy, and that's really common in my profession. Chiropractic is going to do all. It helps, but let's look at the full picture and make sure we get you, you know, as close as we can to your optimal state. There's
no egos in medicine at all, so doctors
right. I had some fun trolling this morning. I just yeah. I don't even, honestly, I don't even engage in it. I just kind of chuckle and hopefully they have a better day.
Yeah, and just like any field, you know, it depends on who you go to as well. So, you know, you've mentioned those top 3 upper cervical chiropractors, and then, you know, you have to be certainly careful with the physicians you choose to try to take care of this problem as well. So, you know, at our clinic, we're the only clinic that offers a true, you know, pickle procedure because we created it and invented it. Yeah. But there are other good doctors out there that maybe be familiar with this, or that can treat some posterior injections. But, you know, the things that you want to look out for, because a lot of people say, well, hey, can I just treat this with prolotherapy? I heard that works for ligaments. Can I just treat PRP? And so most folks that just do prolotherapy, lots of time they just do unguided injections, which you just want to stay away from if you can. Other ones might use ultrasound or x-ray. You can target some of those posterior ligaments, which for non-CCI problems can work really great. You know, if you guys had loss of neck curve and some lower neck issues, prolotherapy to those ligaments can be phenomenal, and that can completely cure things. If you even just have this 2-3 area that's a little bit part of the upper neck that's affected from the posterior ligaments, prolotherapy can be a great source of that. It's not going to help this true CCI up top. PRP, same thing. Even if you got a good provider that can actually target the upper neck joints, which most doctors aren't trained in, because most doctors treat the upper joints in the neck just with steroids so they can lead on to a radio frequency ablation, which is burning the nerves. But there are no nerves you can burn for 0-1 and 1-2 facet joints. So it's not a lot of doctors that have much experience injecting those. So very, very rare to find doctors who are skilled at doing that. So even if you did and you had PRP up there, again, it might help. But in our experience and research, only if you have true CCI with those upper ligaments injected, maybe that can help enough to compensate for about 15 to 20% of patients. But most of those folks are going to be left incompletely helped until they do a pickle procedure. But those are all things that are reasonable to try, but you don't want to go down that rabbit hole for too long if it's not providing help. Yes, absolutely. Mm-hmm.
So if you guys have any questions, I'll look on here so if you guys have any questions. While I'm looking at these, if you guys have any questions, reach out to me, reach out to Dr. Pitts. Dr. Pitts, again, is at Centennial Schultz Clinic. They're over in, are you guys over, what part of Colorado are you guys?
We're outside of Denver and Broomfield, Colorado. So in between Denver and Boulder.
Gorgeous. I would love it. Every time I'd go there, I kind of looked forward to it because, I'd get the procedure, but, man, I would go for like a little kind of mini hike right the day before, get the procedure, lay around in Colorado. It was great,
Yeah, we're lucky. We're spoiled.
Those first few procedures I couldn't hike, though, because I was so miserable. And now I'm running, so it's a lot better.
That's awesome. That's awesome.
Let's see here. Let me see if there's any questions on here. Good old Dr. Ryan Warren. Let's see here. Looks like someone just tagged people in there.
He's one of our favorite chiropractors as well.
Yeah. Good old Dr. Warren. So Dr. Warren, he referred me to you. I would have never known about you if it wasn't for him.
Oh, man, that's awesome.
Yeah. What would be the best way, Dr. Pitts, for someone to reach out to you?
People can just email me directly, jpitts, P-I-T-T-S, at centennialschultz.com. Obviously, you can just call into the clinic, request an appointment as well. But, if you had any quick medical questions or just wanted to see if it was worthwhile, patients can reach out to me directly. So that's my personal work email that I'm checking all day, every day. Perfect. Yeah. And if you guys want to reach out to me with any questions, about upper cervical care, you can call or text our office number, which is 314-356-4030. And even if you're out of town, if you have like questions, if you want to come in town just for the adjustment, if you want help finding someone in your area, if you just need to know, hey, do you think that chiropractic or, someone like Dr. Pitts could help me? Like, don't hesitate, call or text the office. I do free, 10-minute low consultations virtually if you are out of town. Yeah, and we see a lot of people from all over the world. And so we do telemedicine, health visits. We got a lot of information on our website, centennialschultz.com, and there's a certain CCI section there. Dr. Centennial has a great book, which he just updated, that gives you a great overview of CCI. There's several blog posts there. There's some potential exercises to try. Dr. Centennial does videos on YouTube weekly as well, educating folks in this and CCI also. So lots of good information, because I think an educated patient is going to make better healthcare decisions, is going to do better than folks that are less educated and what's going on with them. So unfortunately, we're not in the days where you can just trust everything that the doctor says. You kind of have to dig in a little bit yourself to kind of figure out what's going on, so you make sure that you get in the best care and the most appropriate care. Absolutely. And Dr. Pitts means that about education, because if it wasn't for him educating me so well, I wouldn't be sitting here, educating all of you guys. So Dr. Pitts, again, I appreciate everything you've done for me. You've 100% changed my life. I know you're humble as hell and you just think it's better patient. But again, thanks for everything you've done for me. Anything else you want to add? I think though we covered kind of the main thing. So I just want to make sure patients are aware of what their options are. We don't want you to get scammed, because unlike in cardiology, where hey, you go to a cardiologist, probably a 80% chance you're going to have a good cardiologist. You're pretty consistent. 10% are going to be bad. 10% are going to be extraordinary. In regenerative medicine, and it's going to be all over the board. It's going to be a small number of folks that are really at the top of their game. Then it's going to be maybe a decent chunk that are learning but are legitimate and well-meaning and really good. And then it's going to be just some people just starting off that don't really know much. And then there's going to be a whole group of scam artists or folks that just don't know what they don't know that can bring the whole field down. So I want to help you make good decisions on how to pick a good provider, because we want this whole field to succeed, because I think this is going to be a big part of the future of medicine. But we got a lot of work to train doctors and to get people on board with this. And so not everybody's there yet.
Awesome. And before I forget, guys, get on my website, luxchirohealth.com. There's a CCI or Craniocervical Instability blog on there. That'll explain a lot of the stuff we talked about. It'll explain my story. And other than that, guys, feel free to reach out to Dr. Pitts, reach out to me, and we'd love to help you guys with your health.
Thanks so much, Brett. You're looking great. I think the comments say you're looking like Chris Evans and Tom Cruise.
Ooh, nice. All right. Well, hey, I'm single.
That was all the injections that did that.
That's what it was. Dr. Pitt snuck a little Botox in there.
Thanks, guys.
Thanks so much, Dr. Pitts. I appreciate it.
All right. See ya.
Bye.